Hi, my name's Ernie Metcalf, CEO of Now Young in Bairnsdale, Victoria, Australia. I'm at the IIDL conference and I'm really enjoying the sharing of ideas and best practice concepts.
My name is Charles Bruce. I'm from Canada and here as part of the Mental Health Commission of Canada Workforce Advisory Committee. I've had a great opportunity thus far in my travels to talk about the newly released National Standard on Psychological Health and Safety, and what's been most important to me over the last couple of days and the greatest learning is sharing this with my colleagues and gaining some further understanding of their challenges and how their challenges are very similar to ours, and through further collaboration how we can affect great change.
Hi, my name's Peter McGeorge. I'm a Kiwi living in Sydney. I work at St Vincent's Hospital as the director for the Inner City Health Program. It's a program that involves mental health, alcohol and drug, homeless health, and now we've got a general health component to it as well. And what we're trying to do is to provide a total healthcare program for vulnerable populations living in inner city Sydney. I've been involved with the International Initiative for Mental Health Leadership for forever, basically from the beginning of the organisation. I think the main thing that keeps me coming back and involved in the International Initiative for Mental Health is the fact that mental health leadership, despite the fact that we've been in a new era of community care for the last 20 to 30 years, is still lacking as far as real leaders that are committed with passion and with knowledge and with some wisdom to developing mental health services for communities. No matter whether it's in the inner city or in rural areas. So leadership is absolutely critical to the future, I think, of mental health that is recovery oriented and doesn't revert back to old concepts of psychiatry that relied on hospitalisation and medication. So mental health leaders, as all other leaders in various social service fields, have to have not only a good clinical knowledge, but they also have to have an understanding of people in the context of their families and their communities. And they've got to be able to draw upon all the strengths that are involved, not only in terms of the knowledge that we've gained in the field of psychiatry, but also in the social sciences and in social services as well. In fact, this is one of the organisations that I think is taking a broad approach, involving consumers, involving family and family members and carers, as well as professionals and policymakers. So the challenge, I guess, that the IIMHL is actually addressing is to bring together all those disparate elements and to be able to reinforce this concept of leadership, a leadership that can lead, that has vision and has expertise to make a difference.
My name's Judy Clement. I'm the Chief Executive of the Mental Health Foundation of New Zealand. And this week's an important week in our calendar, being IIMHL Week with us as one of the hosts. And the thing that's been really important for us and for me personally has been the opportunity to have some time with people from other parts of the world who we've discovered are on similar paths to us, and now we've established contacts where we can exchange information ongoing. So for me that's probably the most important part. The networking meetings are good too, but that opportunity to have real direct face-to-face contact and discussion and explore some of your own assumptions and test them out with other people and add to the richness and knowledge. And I think we were particularly fortunate in having such a diverse group. So an important week in our calendar, and one that, to be honest, we weren't necessarily looking forward to, because we wondered how it would go and we were a bit concerned, and can only now look back over the last few days and say what an enriching experience it's been.
Brendan Gracie, Chief Executive Blueprint for Learning, which is part of the WISE group. I attended San Francisco. It was my first IIMHL conference, but I attended as part of IIDL. Found it a pretty amazing experience, both the exchange and the conference. Pretty new for me. Was probably disappointed that there wasn't more of a cross-pollination between IIMHL and IIDL. So great to see that at this conference that is occurring, and there's chance for people to engage across sectors. Was particularly impressed with Shelley Campbell's speech. Thought she was awesome and really displayed, I suppose, and modelled characteristics of leadership. One of the key learnings around the Indigenous presentation was probably how advanced New Zealand is as a nation and a culture around addressing Indigenous issues, particularly that we have a treaty.
I'm Lisa St. George. I'm with Recovery Innovations from the United States of America, and I'm at the International Initiative for Mental Health Leadership, and I have spent the past 2 days in wonderful exchanges, and mine particularly was talking about innovation around data collection and information and feedback. One specific thing that really stood out for me was a tool from the World Health Organization, WHO, and it's across 32 different countries, different languages, and it approaches mental health and wellness from the person's perspective about what's important to them. So it's about quality of life, not problem-focused and illness-focused. And it was just magnificent to learn about that great tool. Do you want me to go on?
Do you have something else to say? It's up to you.
And today I learned about the Inuit culture and about Maori culture and about indigenous peoples around the world and how colonization created challenges that we are still trying to work through in the world, and that have had long-lasting traumatic consequences to individuals, and that we really need to begin to look at and to care about people as a whole and as part of the greater whole of humanity, so that we are all working together for the better, for everyone, not just what one group thinks is best for someone else.
Hi everyone, my name's David Kadire. I'm a New Zealand psychiatrist. Spent the last 10 years leading development of primary mental health programs, currently working with a GP organisation that serves high needs communities here in Auckland. We had a fabulous match actually. For me, the strength of it was firstly the fact that it was a collaborative hosting rather than one organisation, so that added a lot of richness. And the second thing was the real breadth of what the participants brought as visitors. So I think we all got very inspired by a lot of what we were talking about. Our focus really was primary-secondary integration, and about actually how primary and secondary mental health need to become distinctions that we don't think in terms of anymore. So certainly for us as hosts, with a South Auckland focus here in Auckland, New Zealand, it's really left us very fired up about doing some pretty exciting work about getting primary and secondary care working closely together and really breaking down those distinctions so they do become meaningless, and so we can develop more truly community-based delivery of mental health services, which is integrated with a more holistic all-of-health perspective.
My name is Karen Isherwood and I'm a clinical psychologist. In my normal job, I manage the child and adolescent mental health services for Porirua and Kapiti, which is on the south end of the North Island for New Zealand. But right now I am in the 18th month of a 12-month secondment. So at Planning and Funding, where I am advising on issues to do with service development for infants, children and youth. This is my 4th time with the IIMHL. I've been lucky enough to go to a couple of the other countries. This time I was at the Wherry Centre doing the knowledge exchange with the Wherry Centre, which has been excellent. They're the workforce development for child and adolescent mental health, and I actually in my day-to-day job have quite a lot to do with them. The thing that I find most useful about the IIMHL is over time you develop relationships with the people that you meet at the exchanges, and throughout the year I use those relationships to further my knowledge about different problems that come up in New Zealand, because one of the things that we found is that we are actually all dealing with many of the same issues.
Hi, kia ora, my name's Tisha Sprague. I'm from Sydney, Australia. My job is as an advisor for our state New South Wales Health, Mental Health and Drug and Alcohol Office. Our team's called MH Kids, and of course we deal with child, adolescent and family mental health. This is my second IIMHL Exchange and Conference meeting. I enjoyed the brag and steal session so much at the last conference, and this is really what I come to the conferences for. I've spent a couple of days being generously hosted by the Wherry Centre. It's fantastic that because child and adolescent mental health is a relatively small and sometimes overlooked stream, to be able to share with colleagues from around the world is a great opportunity. It reinforces some of the things that we thought that we were doing well. It challenges some of the things that we do to say, oh, I wonder why we do it like that, and can we do better? So it's really a great opportunity for me, and I use it to come back and bring good ideas to New South Wales.
Kia ora. My name's David Comiskey, and I'm from Wellington. I work in a prison near Wellington. I work for Care NZ. I'm the clinical manager of a residential drug and alcohol treatment centre inside a women's prison. This is my first IIMHL conference, and unfortunately I haven't been on the exchange yet, but I'll be going there very soon. What's really striking me about this collection of leaders is the common themes. I've just been in a workshop where there was 3 diverse groups working through challenges for the future in addictions treatment, and it was the commonalities of thinking that struck me as being really valuable. Everybody's on the same page, everybody realises where we need to go, and I think the challenges are how we're going to get there. And I think networking, talking and collaboration is the way to do that.
Well, hello, my name is Daniel Fisher, and I'm from the United States, as you might detect. And National Empowerment Center is the name of our center, and I'm also on the board of the National Coalition for Mental Health Recovery, a person myself with lived experience of mental health recovery. And this is my 5th IIMHL meeting. I appreciate them very much. It's enabled our coalition to connect with other consumer groups from around the world, and we have helped start a group called Interrelate, which is a coalition of people lived experience from all around the 7 countries and even a few others. And it's a great opportunity to meet people, to network, to get new information. I had an idea about next year. I met a couple of the disability advocates and representatives, and I thought a plenary session where people lived experience of mental health, disability, and other disabilities who are activists in our countries could show the similarities and differences and values and activities in our countries, because I've been also putting together a national cross-disability alliance in the United States. And I think that together we can move these policies and hopefully will transform. What came from our own exchange was that it's good that peers are being employed in the mental health sector, but we need to really continue the transformation of the system towards well-being and recovery, so that peers working in the system will be able to further their own recovery as well as the recovery of the people they're working with, and not just be hired, as happens too often now, and I hear it from other countries as well, that peers are hired just to be like junior clinicians in an untransformed sort of medically based system. So our hope is that together, through this international coalition, Interrelate, we'll be able to continue that transformation in all 7 of our countries.
Hi, I'm Rachel Aitchison. I'm the Nurse Director for Mental Health and Addictions at Waikato District Health Board in New Zealand. What I've really enjoyed about being here is understanding the issues that everyone shares commonly internationally, and learning from other people who have either experienced similar concerns or found solutions and been able to discuss them and take their ideas, thankfully, and be able to interpret them into our own practice setting. So I've really valued the energy and enthusiasm and ideas that people have brought with them. And I think what I'm taking away is realising that nothing is impossible, and that where you dare to dream, you can find a solution.
Hi, my name is Carla Bergquist, and I'm the General Manager for Mental Health Services in Central Adelaide in South Australia, and that's a job I've been doing for about 10 months. I am originally a New Zealander and have worked in New Zealand with mental health for many years, so it's been quite a change moving to Australia. It's a great opportunity. The network meeting's a great opportunity to come home and catch up with what's happening in New Zealand as well as in other parts of the world. And I've really enjoyed the cultural experiences in the network meeting so far. It's a good feeling coming home and being part of that.
Hello, my name's Derek Wright. I'm the Chief Executive Officer of Recovery Solutions, which is a drug and alcohol, mental health NGO, a fairly large NGO. I was fortunate to do an exchange with colleagues in Christchurch, which included the DHB as well as non-government organisation. And I guess it was fascinating. One, because obviously they're still recovering from an earthquake, but two is they've continued on a road that they were on before the earthquake, which is about how the NGOs and the DHB actually work together. And they've cleared away a lot of the hurdles that I guess other organisations are still dealing with. So from that point of view, I think it was really, really worthwhile. And I think there's a lot that the rest of us can learn from that.
Hello, my name is Theodora Despotaki. I am the Director of the CEO's Office for Recovery Solutions Group. My exchange was spent in Wellington with Platform. It was a fabulous experience. It was a good experience in terms of being able to see how NGOs form partnerships down in Wellington. It also provided us some insight into some of the community-directed initiatives that are taking place. So I take away my learning from that is that we need to structure our services around what community and what individuals are saying that they require as opposed to what we are assuming is needed. The conference today was day one, and the biggest thing for me that I took from today's discussions was something that Michael Kendrick had mentioned, and it was around beneficial transformation. It's about beneficial innovation. So not just innovating for the sake of innovating, but ensuring that the innovation that you're talking about and the change that you want to bring about is a beneficial change, and it's a change that is directed by what's required and what people are asking for and what communities are asking for. So those are the messages that I will take away with me today.
Hello, I'm Lindsay Wilkinson from England. For me, the benefits are about learning from other people and sharing things that we are either challenging us or which we think we've solved some problems around. So it's about learning from others and sharing and making the connections and knowing that actually there are other people out there trying to do the same things as you. They may be doing it in a different way, in a different system, but we're all fundamentally trying to improve things for people with mental health problems and improve well-being.
Good morning, my name's Lorna Sullivan. I've been part of the International Initiative for Disability Leadership since its inception 6 years ago, and I've had the great privilege really of coordinating this network and watching it grow and develop. Leaving this exchange, what I'm left with is this immense coming of age of a network of international leaders focused on key social reform. We're facing worldwide a rethinking and a re-understanding around the possibilities of the lives of disabled people. And to come into a gathering where the leadership is so clear around what it would take to shift our current systems and processes into systems and processes that are enabling and empowering, and the transfer of power. And these discussions coming from governments, from service providers, from disabled people, from family leaders, gives us great courage, really, and hopefulness that there is an energy now for understanding what this might take. Admittedly, the consensus here is a consensus among leaders. Our big challenges, how do we take this then into our communities, into our societies, and to use the network to generate a social reform agenda. The power of coming together is what enables transformation to occur so much more rapidly, for ideas to share more rapidly, for competencies, for skills, for what we've learned, for the mistakes that we've made, to be openly shared with no other agenda other than this is the direction in which we're going. These are the challenges we have before us. This is what we can bring collectively to those challenges. Is something you do not get readily, and IIDL is a wonderful mechanism for enabling.
IIMHL was developed to help leaders in mental health lead better and to change systems for consumers and for the public. Doing things together is much better than doing it alone, and mental health reform has been a struggle in all of our countries. Getting the right kind of services for people and for communities has been something that we've all been challenged with for a long time. Collaborating with people that are doing the same thing and facing similar issues in other countries has been a fantastic way of learning how to do things better, learning new ideas, of learning how to adapt things that work well in other countries to your own country, and just talking with people in their endeavours and their struggles and their challenges, and also their successes, and hearing about their successes. My experience has been that people learn better when they know each other, trust each other, work together, and can talk in a passionate and excited way about new things that are happening. And that has been happening through IIMHL over the last 10 years. It's been fantastic to see the differences made in all of the countries in terms of mental health services development, because of initiatives that have happened in countries individually and then learnt from and adapted and grown into new and exciting things in other countries. The important thing about IIMHL is that it's government supported by all the countries, and it's also an opportunity for people to meet with peers. So it's a great peer learning, whether you're a manager of mental health services, whether you're a clinical leader, whether you're a consumer leader, whether you're involved in Indigenous communities and the challenging issues that they have. It's about a peer-to-peer relationship and learning from each other in that way.
I'm Irv Brinker. I'm from Michigan in the United States, and I'm the CEO of a provider organization. And I've been involved with IIMHL from the beginning and have attended each of the different conferences and have enjoyed each one. What I have found, and I'm also a board member of IIMHL, one of the reasons I am so supportive is it is wonderful for us to learn from our peers, from our colleagues, from others. And what we've learned is there are more similarities between us from all the different countries. We're all working towards the same end. How do we help our citizens have a better quality of life? And what are the things that we can do so that we can provide those resources? This is an opportunity to not only learn from our colleagues and from people from different countries from around the world, but it's also an opportunity to see and to experience different cultures, which is really helpful in terms of working with people who are different. And in the spirit of diversity, this is just a wonderful opportunity to learn more and to be able to deliver and provide a much better service in coordination, in conjunction with people in our communities. I am a vibrant and enthusiastic supporter of IIMHL.
Kia ora, my name is Robin Shearer and I'm the Chief Executive for Te Pou, and we're a member of IIMHL. New Zealand participates and gets involved in working with other countries to progress our mental health, addiction and disability services. The types of benefits that we get from IIMHL are to work with peers who have tried new practices, who are looking at workforce development and systems improvement, and also to gain an understanding of what works and what doesn't. How do you really put evidence-based practice into operational activity? How do you promote strong leadership? What are the sort of innovative ideas that you can share? And how do you connect with someone who's been there and done that? So for us, IIMHL is a good example of how we can learn from others and to have an outward-looking focus in terms of not just being involved in what happens in New Zealand, but across the world. Given that we're countries involved in international activity and sharing technology solutions, we want to look to others to see how we do things, but also share our own experiences.
Hi, my name is Ian McPherson. I'm from England, and I've been involved with IIMHL since it got established, so I think this must be my 10th event. and it's undoubtedly been one of the best ones. The energy, the enthusiasm, the warmth that we've got from New Zealand colleagues has been fantastic. It's been great to meet some old friends, but actually very nice too to meet some new ones, and including from countries who have not participated before. So I would strongly recommend, come and see it, understand it, do it for yourself. It's the best bit of continuing professional development I've ever done.
Hi, my name is Kathy Langlois. I'm from Health Canada, First Nations and Inuit Health Branch, and I am the outgoing chair of the IIMHL at this time. And I just wanted to say, why join IIMHL or why support IIMHL? Well, first of all, IIMHL is an organization that brings together people to rapidly exchange knowledge about mental health and about improving mental health outcomes in the populations that we serve. Secondly, IIMHL involves 7 countries across the world, so you have a tremendous diversity of experiences and knowledge to come together and exchange. And thirdly, there are a number of diverse groups and people involved in IIMHL. And the main thing about IIMHL is that it honors people with lived experience, from which we see the best innovations and approaches to improving mental health outcomes. And that's why I would join and support IIMHL if I were you.
Hi, I'm Martin Rogan. I'm chair of the IIMHL. If you're working in the dynamic area of mental health, there's a real opportunity here for you to meet with people who are thought leaders and innovators right across the world. From our membership countries, we have members who include policymakers, chief executives, service users, carers and family members, people in the academic domain, and senior clinicians. And if you're embarking on a change process, it's probably very useful to hear what's already happening out there in terms of new innovations, promising practice, and exciting things that are happening in the world of mental health. It's quite likely that you're operating in a challenging economic environment, and there are new methods and new technologies that are breaking forward that can allow us to reach out and support individuals, their families, and our communities in a much more effective way. So if you're a policymaker, if you're leading change, or if you're about to embark on a change process which involves revisiting how services are offered, where they're positioned, the recovery orientation, or indeed trying to improve the services for the population in your community, I would highly encourage you to join IIMHL and join with your international colleagues in driving forward quality mental health services.